Hi, welcome back to the channel. So you've signed your first contract, you're working in a clinic, and things seem to be running pretty smoothly. But how do you know if your self-employment status is truly being respected? In today's video, we're diving into how to protect yourself as a self-employed RMT. I'm going to cover what you should look for in your clinic contract and how to spot red flags that could blur the lines between contractor and employee. If you want to build a sustainable practice while staying legally protected, then this one's for you. Let's pause there and head over to YouTube so we're sure to watch the full video. So your classification as an independent contractor affects how you're going to file your taxes, how you're going to manage your income, and even what legal protections you have. If the CRA views your role in the clinic as too similar to an employee, both you and the clinic could face penalties. I've got some examples and some key elements to consider when trying to decide if your contract is a self-employed contract or an employee contract. Take a look at who has control in the contract, how and when you work, and how does that clinic decide or dictate that to you. Now, how about supplies? Oils, linens, laundry detergent. Who is providing and who is responsible for maintaining the equipment? Is there any part in the contract where you take on any business risk, such as paying rent or having gaps in your schedule? The liability and financial risk should fall evenly on both parties. Now, as a self-employed RMT, in your contract, does it reflect where you can increase your own earnings through marketing or rebooking or your effectiveness of treatments? Do you have control over your monthly income? Here are some examples of wording that can imply some kind of an employment contract. Look out for specific words like employee or supervisor, salary, or anything that might imply some kind of a direct oversight or control over any one thing. Contracts that refer to shifts instead of available treatment times can also indicate an employee type of environment. Your contract should clearly state that you're an independent contractor and not subject to employee-style management. The way you get paid definitely matters. Here are some red flags to watch for in your contract. Does the clinic control all of your billings without any kind of transparency or access to numbers? You should always remember to be able to track your billings either through reports in JNAP or through your own record. Payout structure should be clearly defined: percentage, split, flat fee, or rent in your contract. As an independent contractor, remember, you should be providing the clinic with an invoice for your services. However, most clinics have their accounting or admin take care of this for you. Consider that when looking at the contract percentage. Avoid clinics that withhold arbitrary fees without explanation. If there are separate fees that are included, be sure that you get an invoice of what those fees are for your own records. Then you can use it as a tax deduction come tax season. So a few other areas and items to watch for and make sure that you have clarity on before signing your contract: clauses about cleaning responsibilities, patient care follow-ups, and even mandatory meetings or training that your clinic might require. These things aren't always a problem, but they should be clearly outlined and not treated like employee obligations. Make sure that you ask questions before signing your contract and understand all of the different clauses that are laid out there for you. Now, I always suggest compare contracts. Don't take someone's word about a clinic or an offer of a signing bonus to make up your mind about where to work. Take your time and don't rush it. Ask questions about anything that's unclear. The clinic owner should welcome these questions and be happy to clarify for you. You may even want to try consulting with a mentor or a legal advisor. Everyone has a different perspective, and it's great to get advice from mentors who have been through those contracts before. Now that you've decided on the contract, it's signed, you're ready to start seeing your first patients. Things can start to get overwhelming really fast. Patient files can start to pile up, your billings are rolling along, and your schedule is filling up fast. Feels great to be making a steady income again. But stop! Don't forget, you're running a business. Stay involved in your financials. Always check your weekly and monthly billings. Track your payouts and ensure they align with your own record. All right, congratulations. You've now been working hard for a few months and you're just not feeling the operations. Maybe it's the clientele, or maybe it's even your coworkers. How do you know when it's time to walk? Perhaps your value as a practitioner and the knowledge that you bring to the clinic is not being valued, or you find you're not making enough from the agreed contract for the tasks and services you offer. Maybe you're being restricted from making decisions that impact your practice and your business. These might be signs that your clinic isn't quite right for you. Or these might be signs that your clinic isn't respecting your role as a contractor or practitioner. There are plenty of clinics out there that do respect boundaries and offer true independent opportunities. So don't settle. Keep looking for the right fit. Remember, being self-employed doesn't just mean choosing your own hours. It means protecting your title as a professional, creating and maintaining boundaries, and making smart business decisions. The more you know going into a contract, the more empowered you'll be to build a practice that's both profitable and sustainable. If you found this series helpful and helped you become more confident stepping into a clinical setting, be sure to like, comment, and subscribe. I've got more content coming to help you build your career that lasts. And if you have any questions about contracts or clinic dynamics, drop them in the comments below, and I'll make sure to cover them in upcoming videos. Bye for now!